Hello everyone and welcome to my first video. My first presentation is on early intervention, and this is just meant to be an introductory presentation for parents. So hopefully if you've never heard of early intervention, then you're in the right place. Hopefully today you'll learn a lot, and maybe your child is already aged out of early intervention, or maybe you're in it right now. I still hope that there's something that maybe you can take away, or that you can a piece of advice that you could maybe give to another parent. So either way, I hope this is beneficial for you. To introduce myself, my name is Lydia. I am a doctoral occupational therapy student at the Robbins College of Health and Human Sciences at Baylor University, and let's go ahead and jump in. So let's start with the basics. What is early intervention? So we use the term early intervention to refer to the supports and services that are provided to these children from 0 to 3 years old when they have developmental delays and disabilities. These are publicly funded state programs. So in Texas, this program is known as Early Childhood Intervention, or ECI. It is also important to note that within the state of Texas, there are different programs that serve different areas of the state, but the program as a whole for the state of Texas is known as ECI. You might hear providers or other parents use the term ECI. So services that are provided to the children are provided for free or at a reduced cost to families, using something called family cost share. This is basically where the amount that a family pays is calculated by taking into consideration the number of people in the household as well as the family's income. It is important to note that no child or family is turned away because of an inability to pay for services. Now, the learning for early intervention takes place where the child is already living and learning. This can be probably most likely a family home, but also community-based settings such as a park or a daycare. It places a lot of emphasis on the child learning in their natural environment. Early intervention services are also going to focus on a few different areas of development for the child. For example, physical development. Are they reaching their motor skills like they should? On their cognitive development, are they able to think and to learn? Their communication, being able to talk and to understand and to listen. Also, their social and emotional skills. Are they able to play with others, to name their feelings and express those in a way that is socially acceptable? And then also self-help domains. Are they able to do the things for themselves that they need to be able to do, such as brush their own teeth or help mom get them dressed? The things that they can do to be independent. Let's talk a little bit about why we have early intervention. It seems kind of intense and like a lot for such a young child, but it is all for good reason, mainly to help prepare the child for success in school. That's where they'll be headed after they age out of early intervention, and we want to help minimize any developmental delays while we can. We want to help them improve upon the skills that they have and overall just support the family functioning. That's something that's really unique about early intervention, is that there's a huge emphasis on equipping parents, on educating parents, and providing lots of opportunities for parents to get their questions answered. Also, this concept of early intervention is widely embraced due to our knowledge of neuroplasticity in children at this age. That's just a fancy way of saying that at this age, children have an incredible capacity for learning, and we want to take advantage of it. And so intervening at this age is crucial for their success in the future. Early intervention is made possible by an important law called the Individuals with Disabilities Education Act, which we'll talk about on the next slide. So the Individuals with Disabilities Education Act, or IDEA, is the really important law that grants children with disabilities the right to an education and the educational services that they need in order to be successful. Part C of this law is what covers early intervention and gives them access to those services. And also under Part C, I want to mention that a few different parts of early intervention care are free for parents. This includes the early intervention evaluation, case management, IFSP management, which we'll talk about here in a second, and also translation services should the family need that. All of those services are provided at no cost to parents. This is kind of a side note, but Part B gives individuals from ages 3 to 21 the right to a free, appropriate public education, which is what we call FAPE. But I wanted to draw attention specifically to the age range. A lot of parents, especially new ones, might not know that children can stay in the public school system until they're age 21, which of course differs from what we see in children that are neurotypical, who usually end by the age of 18. So there are a few extra years in there for our kiddos with disabilities. Now we can move on to eligibility and how a child becomes eligible to receive early intervention services. So a question that new parents might have is my child with Down syndrome eligible, or how do I find out if they're eligible? And the answer is yes, they're eligible. If they have Down syndrome, they're eligible. And that's because children have to meet one of three criteria. They have to have either a diagnosed condition that's on the medically qualifying list, which Down syndrome is, so that's how they qualify. But children could also have an auditory or visual impairment or a developmental delay that's determined by an evaluation that could also qualify them. It's important to note also that parents can receive a referral from the hospital when their child is born to start early intervention services, but they do not have to wait for a referral. Parents can actually refer their child themselves. And I have a phone number here on the screen for the state of Texas that they can call. It's 877-787-8999. So make sure to write down that number if you or someone that you know needs it. But I'll also put on the resources slide at the end of this video a link to an ECI locator. And this you put in your zip code and it will pull up the program that specifically serves your area of Texas. So either one should be fine. It's important to note that when you refer, they only have 45 days to start screening, evaluating, performing the assessments, and writing the IFSP, which we're going to talk about finally, if the child is eligible. So all of that has to go ahead and happen within 45 days of the referral. So they're going to start getting the ball rolling right away. So let's finally talk about the IFSP, or the Individualized Family Service Plan. This is basically what it sounds like. It's a plan that is individualized to you and your family, and it's going to outline the services that your child and family will receive in early intervention. So it's going to address the child's goals, and it's going to outline what services do they need to help them reach those goals. This is a document that is reviewed at least every 6 months, and it's updated at least on a yearly basis. So when the team is planning the IFSP, they're going to review your child's goals and they're going to discuss your priorities and concerns. This is the chance for you to tell the team what you really want to be able to see your child do, and they are going to take that into consideration, of course, as you are the expert on your child. They're also going to determine the necessary services they need, what environment the services should be given in, and they're going to identify who your service coordinator is. Finally, already they're going to start talking about where is your child going out of early intervention and how to make that a smooth process. So sometimes talking about it isn't as good as looking at it. So this is just a template of what your IFSP might look like. Basically, there's just some information about the child, and then you'll see in those columns, it really just is going to outline the service, who's going to give it, when they're going to give it, how often, where, and when it's starting and when it's ending. This just kind of gives you a general overview of what yours might look like. So let's go ahead and talk about the early intervention team. It's made up of several professionals, and they all work together to help meet the needs of your family. We're going to talk about who you might have on your team, and then we're going to go in depth on each person's role and talk about what they might do to help meet the needs of your child. So all of the amazing people on your team are going to represent a variety of different backgrounds. They're going to come from different professions and have different educations, but they're all going to work together and use what's often called a transdisciplinary team approach. This just means that there's an emphasis on the team working together to look at the child and all of their goals, rather than each professional just focusing on one little area because that's what they know. It's going to help reduce fragmented care, and it encourages everyone to look at the whole child and all of their needs and consider that as they practice. There also might be one professional that takes the lead in supporting all areas of development. Even if their background is, say, a physical therapist, they're still going to be responsible in taking the lead for your child as a whole. So really, who you have on your team is going to totally depend on your situation and your family and your child, but they could include a service coordinator, social worker, different therapists like occupational, physical, speech, a registered nurse, really tons of different professionals, psychologists, dietitians, counselors, infant mental health specialists, audiologists, pretty much you name it, and they could be on someone's intervention team. So on the last slide, we listed some of the most common professionals that might be involved, and now we're going to kind of go through them one by one. Just ones that might be more common, might be ones that not everyone's totally sure of their role. We're going to start off with a service coordinator, who is very important because they are the single point of contact between the parents and the service agency. They are basically responsible for anything that the parents have issues with as it relates to service coordination, whether that's they want to find a new provider for one of their services, whether their schedule has changed and now they need a provider to come at a different time, or they're having financial hardships. All of that is going to first go to the service coordinator. This could also be someone who has another professional role on the team, and they just happen to also be coordinating services for the family, but it could also be someone whose only job is to do service coordination. And they're going to help parents problem solve through any of the issues that come up that are related to their family's care. So there might be a social worker on your team. Social workers assist families facing challenges, and they're able to find resources and supports in the community to help meet their needs. They are also specifically trained in crisis management, emotional support, and in resource support. They actually might be your service coordinator, or they might be available to you for a short amount of time when they're needed. It really just depends on the individual case. As an occupational therapy student, my opinion might be a little bit biased, but I think OTs are probably one of my favorites on the early intervention team. Occupational therapists are concerned with your child's ability to engage in their everyday activities. So they're probably going to look at how your child moves, interacts, and is successful in their everyday activities such as playing, feeding, etc. They are also experts in adaptive techniques, so they might be able to make some recommendations for you on some tools that could help your child be more successful. Some specific things that they might address include your child's ability to self-feed and to bring food to their mouth, to chew correctly, to control their tongue movements, etc. They also are concerned with your child's cognitive skills and their ability to pay attention to objects and to people and kind of build the foundation for social skills. They also are concerned with fine motor skills, which is what a lot of people think of when they hear the term occupational therapist. They're going to look at their ability to grasp and to pinch and to grip things. But they also might look at other things like your child's executive functioning and their ability to self-regulate themselves and to plan out certain things. All of these skills emerge in early childhood and are super important, and those are the types of things that an occupational therapist is going to look out for and work on with your child. Another really important member of the early intervention team will likely be a physical therapist, especially for children with Down syndrome who often have low muscle tone. They're going to really work to maintain and improve movement skills, and they're going to look specifically at gross motor skills. That means things that take big body movements like rolling, sitting, crawling, standing. They're going to make sure that your child is hitting those developmental milestones. They're really going to work with the child and probably use a lot of exercises and strengthening and proper positioning to make sure that they are hitting those milestones like they should. Another great asset to the team is a speech-language pathologist or a speech therapist. They really specialize in human communication. They're going to work on speech, language, communication, and even swallowing skills with your child. They might help the child in their ability to speak, or they might collaborate with you to find other ways for the child to effectively communicate and express their wants and needs. They also might, right alongside the occupational therapist, address feeding. They have a great wealth of knowledge in swallowing and how the mouth works, and so it is likely that those two will overlap a little bit. Next on the team may be kind of surprising, but a nurse might be on your team. And now the way most of us think about nurses is reflected in this first statement that I have on my slide, where they're trained in promoting health, preventing illness, and treating people when they're ill. However, nurses on the early intervention team may be actually in the role of a service coordinator, especially if this is a child that has maybe multiple health issues, a few different diagnoses to keep an eye on. They are probably not going to provide direct nursing care in most cases. Most likely, again, it would be in more of a service coordination position. Now that we've talked a little bit about starting early intervention services and what that looks like and who might be your providers, let's talk about transitioning out of early intervention. If you'll remember on my slide about the IFSP, that's one of the things that from the beginning they start thinking about for the child. So once a child turns 3 years old, they are no longer eligible to receive early intervention services, but they do move on to be eligible to receive special education through the public school system. Now, eligibility is a little bit different than it was for early intervention for special education. For special education, they have to fall under one of 13 diagnostic categories, but children with Down syndrome still do qualify for special education under those categories. They include things like deaf and hard of hearing, autism spectrum disorder, intellectual disability, orthopedic impairments, speech and language impairments. Truly, there are so many and Down syndrome is covered by them. Now, it's important to note that a transition meeting will take place to plan out the logistics and the details of the child's transition out. This takes place at least 90 days before the child's 3rd birthday. So a few months before, we're already preparing for that move. This will include parents, members of the team, and also representatives from the local school district. In addition to that, this whole transition process has to be completed by the child's 3rd birthday. So that's a hard deadline. That way, by the time that they actually turn 3, everything's set in stone and ready to go. So this slide kind of goes into the logistics of how that transition is made. I know some parents might be stressed. Do I need to do something? How do I get in touch with the school? ECI actually initiates contact with your local school district, and within 45 days of that contact, they're going to start to evaluate the child. So this little chart right here, kind of flow chart, shows that ECI is first going to request consent from you to share the information with the school. Once parents give consent, ECI contacts the school and they share, hey, we have this child, this is their diagnosis, and the school gets consent to evaluate the child. Then an evaluation within that 45 days will happen, and they will determine, yes, your child is eligible for special education, and so that's kind of how that process goes. So where your child ends up after early intervention is really up to you and the choice that you and your family decide is best for your child. But here I have a few potential settings that they might transition to, such as a standard pre-K classroom or a self-contained special education classroom, or even a community-based setting like a private preschool at your local church. I also wanted to note that when we talk about the fact that children have a right to special education in the public school system, this includes specialized teaching and the related services that they need to meet their educational goals. These related services refer to things that we talked about earlier, like speech, OT, and PT, and other services that they need to be successful. All of these are going to be outlined in their individualized learning plan, which is kind of its own topic on its own, but basically it replaces the IFSP and it outlines where the child is at, what goals they have, and the plan to help them meet their goals. So although ECI makes that initial contact with the local school district, there are definitely some things you could do as a parent to make this a little bit of a smoother transition for your family, and maybe it'll save you some stress as you get closer to that transition time. You can begin to think about the transition out of early intervention at the beginning. Just like we talked about with the IFSP, how the team will begin to think about that transition out. You as a parent, as the expert on your child, can begin to think about that as well. Use that early time to start looking at resources and to start looking into different places. Think about your child and where they might fit in, and it might save you some worry later. You can also talk to other parents about their experience. The Down Syndrome Association is a great place to do this. You can get in contact with other parents, talk to them about where they decided to send their child, how they liked it, how it went for them, and maybe you'll get some advice that way. You can also contact your local school's special education department. You can ask them, hey, how can I best gather information about my child for you? What do you need from me? You can ask them about taking a tour maybe, about what resources they have for parents, things like that that will help equip you and prepare you for that transition. Next, follow up on any leads. If a parent tells you about an awesome school that they sent their child to, follow up on that. Look up the school, call the school, take tours, think about whether your child could fit in there, look at student-teacher ratios of places that you've heard of, look into the teaching style, and just try to envision your child there and see if it would be a good fit. Next, familiarize yourself with the curriculum. You can usually do this by accessing it online, or you can contact the school and ask for it, but look into what they're teaching, what they expect of the children in that preschool and kindergarten classroom, and think about what level of inclusion your child would need in that scenario, and if that would be an appropriate placement based on the demands that are going to be put on them in that classroom. So we've made it this far. I hope that you've learned something valuable along the way. As we wrap up this conversation about early intervention, I do want to emphasize a few final thoughts. Number one, early intervention is a new process for all parents when they go through it for the first time. You do not need to feel pressured to know all of the answers or to learn everything at once. Take in information at a rate that is comfortable for you. If you don't want to jump into the plethora of information online and you just want to find a good person to hear about their experience and connect with a family that you know, do that. If you like looking online, you like learning all the things, then by all means jump into that. Also remember that early intervention programs exist to help you. A lot of parents end up loving their experience, loving their children's providers, having such a trusting bond with them. Ultimately, the early intervention team is there to support you. So remember that. Any questions that you have, don't be shy to ask them. They are there for you. And finally, this phase of life is so precious and time moves so quickly. So prioritize enjoying your little one, all the milestones that they're meeting, record all the videos, and cherish these days because they don't stay little forever. On this slide, I've just listed a few resources that I think could be helpful for you. The Texas Health and Human Services ECI webpage is going to have all the basic information about early intervention, and you can find it at that link there. There's also a Parent's Guide to Early Childhood Intervention and Early Childhood Special Education on there that I've linked as well. Also, the Down Syndrome Association of Houston is a great place to meet other parents that have children with Down syndrome. If you want to get connected to someone to hear about their experience, or you just want to get involved, find the next fun event that they're doing, the website is right there, and you can always feel free to email info@dsah.org for any questions or anything like that. I've also listed 2 books, The Parent's Guide to Down Syndrome and Babies with Down Syndrome. I personally read these my first few weeks here at the Down Syndrome Association of Houston, and I think they're so helpful. Some of the information in this presentation was pulled from these books, and I highly recommend reading them if you haven't already. So we've made it to the end of this presentation. Thank you so much for your participation. I cannot emphasize enough how appreciative I am for all of you participating in my doctoral capstone project. Please stay tuned for the next few weeks for more content and for the survey that I will be asking y'all to take. I greatly, greatly appreciate it. Of course, in the meantime, if you have any questions, please feel free to email me. My DSAH email is listed there. You can also email the general DSAH email if you have more general questions, but if there's anything about this presentation specifically, feel free to shoot me an email. Thank you guys so much for your time and attention.